What if I told you that for millions of women, this isn't enough for even 1 hour? Heavy, life disrupting periods are not normal. And in the next few minutes, I will show you one of the commonest cause for heavy periods and how to manage them without needing a major operation. Hello, I'm Dr. Saurabh Phadnis. I'm a consultant gynecologist and gynecological oncologist specializing in London. And I see a variety of women with problems such as heavy menstrual bleeding and also gynecological cancers. One of the frequent problems that I see is heavy menstrual bleeding or menorrhagia. It's a condition that so many women suffer through in silence, thinking that's their lot in life. My mission is to change that. Heavy menstrual bleeding is a medical condition that can be treated. Today, we are going to focus on the number one cause of heavy menstrual bleeding in my practice, uterine fibroids. We will cover how to know if your periods are abnormally heavy, how fibroids cause it, modern tools that we use to detect fibroids, and uterine preserving surgery that can give your life back. Think your periods are heavy? Here are 5 signs that medically they are not normal. So let's start with the most important question. How do you know if your periods are heavy? We use this clinical checklist to assess the intensity of your period. Number one, are you changing your pads or tampons every hour or frequently within 2 to 3 hours? How many tampons are you using or pads are you using in a daytime? Have you had to get up in the middle of the night to change your pad or tampon? Or have you seen that if you don't do that, your clothes are stained or your bedsheet is changed? Do you pass clocks during the periods? Is your bleeding heavy and for more than 7 days? And the most important question is, does your period stop you from doing things that you would normally do? If you're answering yes to these questions, then clinically your periods are heavy. This is not just a inconvenience because heavy menstrual bleeding over a long period of time will cause anemia, particularly deficiency in iron, and that itself can impact your quality of life and your ability to do normal things that you enjoy to do every day. It's a sign that your body is telling you something is not right, and it's my job to listen and assess the situation. This common non cancerous growth could be the real reason why your periods are heavy. Now that we have defined the problem, let's look at the real issue here, uterine fibroids. These are incredibly common non cancerous growths from the muscular part of the uterus. But how do they cause heavy menstrual bleeding? If you imagine during the periods, the uterine muscle, which is very elastic, sort of clamps down to stop the blood vessels from releasing the blood. Imagine placing a hard ball in that soft tissue and the uterine muscle trying to squeeze to stop the blood vessels. It's going to come in the way. And the blood vessels remain open over a long period of time, thereby causing heavy menstrual bleeding. Also, some fibroids called submucosal fibroids, when they are inside the cavity of the uterus, they expand the surface area of the lining of the uterus, thereby causing prolonged bleeding and heavy menstrual bleeding. It's a simple mechanical problem that leads to a very disruptive symptom. This is how we find the hidden cause for your heavy periods. When a patient comes to my clinic with complaints of heavy menstrual bleeding, first of all, good history taking is necessary. I ask you the relevant questions that will help me diagnose the problem. With regards to investigation, although ultrasound scan can be helpful in diagnosing uterine fibroids, we often use MRI scan to map the fibroids to find out where they are exactly located in the musculature of the uterus. Having said that, the gold standard to examine the uterine cavity for any fibroids is a procedure called hysteroscopy. Hysteroscopy is minimally invasive procedure where a very thin camera which is got a light source and a live video feed is introduced through the vagina into the cavity of the uterus. Thereby, I can assess the entire cavity of the uterus and the uterine lining to see if there are any fibroids that are disrupting the lining and causing the heavy menstrual bleeding. Hysteroscopy is also useful in finding out conditions other than fibroids like polyps. Polyps are outgrowths from the lining of the uterus that can often cause bleeding, which is heavy or in between the periods, or sometimes bleeding after sexual intercourse. If that is diagnosed, often polyps can be removed at the same time during the procedure. Want to treat your fibroids but keep your uterus? Listen to this. For patients who are suffering from heavy menstrual bleeding due to presence of fibroids and wish to preserve their fertility, we advise them to have a operation called myomectomy. Myomectomy is an operation to remove the fibroids but preserve the uterus, thereby retaining fertility. Myomectomy can be planned depending on the location of the fibroid. If the fibroid is inside the cavity of the uterus, then myomectomy can be done via the hysteroscopic route, which is using a thin camera via the vagina. This does not involve giving any cuts, and often recovery from such an operation is quicker. If the fibroids are within the body of the uterus or projecting inside the belly, then the correct route for excising these fibroids is to enter through the belly, thereby needing a cut on the belly. Depending on the number of the fibroids, the size of the fibroids, this can be achieved by keyhole surgery via laparoscopic route or robotic route, or if the fibroids are many and large, then sometimes we have to do surgery via open incision like a cesarean section. This is not about removing the organ, but preserving the organ and removing the fibroids, thereby retaining fertility. It's a highly effective procedure that resolves the heavy menstrual bleeding and gives you the choice of retaining fertility and your choice to keep the uterus. Does size matter? When it comes to fibroid, here's what you need to know. This is a question that is asked to me almost every day. Does the size of the fibroid matter? And the simple answer to that is actually your symptoms are more important. So, for example, a 2 centimeter fibroid that is inside the cavity of the uterus can cause torrential heavy vaginal bleeding and can cause detrimental anemia. Whereas a 10 centimeter fibroid which is growing inside the belly on the outer surface of the uterus may cause no symptoms at all. So your symptoms are important, and we often say to the patients, we don't treat the size of the fibroid or we don't treat the scan itself, we treat your symptoms. Most important measure in the management of your fibroids is intensity of your symptoms and whether they are affecting your day-to-day life. When I make decision plans, when I discuss management options, these options are based on your intensity of your periods, how they are affecting your daily activities, your wishes regarding fertility, and your overall health. The size is just one piece of the puzzle. Your symptoms and your experience is what matters. What does life look like after fibroid surgery? Here's what changes. So, what happens after fibroids are removed or gone? Your life changes dramatically. Your periods may be shorter or lighter and more manageable. The constant fatigue from anemia goes away as your body replenishes the iron stores. The pain, bloating disappears. You can wear light colored clothing without fear. You can make plans without checking your calendar first. It's about more than just stopping heavy bleeding. It's about getting your energy back, your freedom back, and your life back. It's a return to normality, and for so many of my patients, it is a truly transformative experience.